Hi everyone, I'm Raymond Francis, and today I have some good news about a solution to the most important social and economic problem of the 21st century: global aging. Global aging is the greatest demographic change in the history of humankind. By 2050, there will be more old people in the world than young people. There will not be enough young workers to pay the bills. This development presents unprecedented problems that are threatening to bankrupt the United States government and all the other industrialized nations. Economists are predicting that we're on our way to an economic and financial meltdown. Should this be allowed to happen, the life of every American will change for the worse. By 2040, the number of Americans over age 80 will exceed the number of preschool children. With more than 10,000 baby boomers retiring every day, 10,000 people retiring, the Congressional Budget Office says the path we are on is economically unsustainable. By 2030, federal spending for just 4 items, Social Security, Medicare, Medicaid, and pensions, will exceed total federal revenues. This will leave nothing for any other purpose. The United States will be reduced to third world status, unable to honor its financial obligations. The government has made promises it can't keep, and this problem requires our immediate attention because the need is urgent. And the government is paralyzed because the drastic and politically difficult measures needed to address this problem, including substantially raising the retirement age, enormous increases in taxes, and reducing retirement and health benefits, nobody's going to do that. So is there another way to address the problem? Is there another way to solve this crisis? I suggest there is. According to health economist Victor Fuchs, the 800-pound gorilla in the room is the cost of health care. An unprecedented epidemic of chronic degenerative disease, combined with our aging population, is rapidly increasing healthcare costs to where they will become a burden even bigger than government pensions. Consider the unfunded liabilities of Medicare are more than 6 times the unfunded liabilities of Social Security, and we don't have the money to pay Social Security. Chronic diseases are expensive to treat, and the share of people requiring institutional care continues to grow rapidly. Health costs are now more than 17% of the GDP. What if we could cut healthcare costs in half, cut them in half, down to a single-digit percentage? What would that do for us? The economists say it won't solve our problems, but it will make them manageable. So we go from unsustainable to manageable. Cutting costs in half is a worthy goal. Can it be done? Yes, it can. We can't stop people from getting old, but we can stop them from getting sick. To do this, we urgently need a new level of thinking. Instead of repeating the same old mistakes, we're stuck in a healthcare system that doesn't work because it focuses on managing the symptoms of disease rather than on maintaining and restoring health. Thus far, the public debate has been about how to pay for disease. This has to change. The real solution, the win-win solution, is to teach people how to be healthy so they don't get sick. No disease, no costs. Yet this solution is not part of the debate. So we need to change the debate from how to pay for disease to how to prevent disease. Better health is an achievable goal. It must become a priority. What is required is an unprecedented educational campaign to teach people how not to get sick. The truth is, good health is a choice, and you can learn how to choose it. But health is a choice, not yet chosen. To save ourselves and our economy, We must give health a chance. Fortunately, the knowledge we already have is sufficient to prevent and reverse almost all disease, simply by supporting the body's own innate healing abilities. A sustainable society depends on the health of its citizens. Yet we have a sick population whose health is in a long-term downtrend. More than 75% of all Americans have at least one chronic diagnosable disease. This includes allergies and clogged arteries and arthritis and diabetes and cancer. More than 90% of people over age 65 have these chronic diseases. Even our children are suffering an epidemic of ADHD and allergies and asthma and autism and cancer and diabetes and obesity. Unfortunately, our own observations and experience lead us to believe that disease is inevitable and that we're not in control, and that good health and long life is the result of good genes and good luck. This is not true. It really all depends on the choices we make. The human organism is a magnificent, self-regulating, self-repairing system. It's capable of keeping you fully functional and in excellent health for well over 100 years. Your job is to make the choices that support this system. You are the sum of everything that goes into your body, and for the most part, you control what goes into your body. Given adequate support, your body will reward you with the gift of good health and long life. If we all did this, our chronic disease epidemic would disappear, along with its costs, potentially preventing a catastrophic economic collapse. What would be helpful is a simple teaching tool to help people master the most important elements of health. Health is infinitely complex, so we need to simplify it. I developed such a tool. I call it the Beyond Health model because it's capable of taking you beyond health as you know it. This model is based on the concept of one disease, two causes, and 6 pathways to health and disease. People around the world have used this model to cure themselves of incurable diseases. Yet this model is so simple, I've taught it to 10-year-olds. So if you learn and apply it, you can change your life for the better. Let's have a look at the model. How's this for simplicity? There's only one disease. There's only 2 causes of disease. This simple concept cuts through the confusion, takes the mystery and complexity out of disease, and empowers people like you to take charge of their own health. What is this one disease? Malfunctioning cells. A cell is a little microscopic unit of life, and each of us started life as a single cell. That one cell has now grown into a community of tens of trillions of cells, communicating and cooperating with each other, and we call this community our body. All tissues and organs are made out of cells. All bodily functions are carried out by cells. Your cells are what make your life possible. So if you understand what your cells need and what causes them to malfunction, you will have the knowledge you need to prevent and reverse virtually all disease. What causes cells to malfunction? Well, there's only 2 reasons. 2 causes of cellular malfunction, and therefore only 2 causes of disease: deficiency and toxicity. Either cells are getting too little of what they need, or too much of something they don't need: deficiency and toxicity. So to prevent and cure disease, you must focus on addressing these 2 causes. As part of the body's normal maintenance and repair process, old cells are constantly being replaced with new ones. Hundreds of billions of new cells every day. If your new cells are not constructed properly, they will be unhealthy and weak. Yet most of us are deficient in at least several critical building materials. So lacking these necessary building materials, your cells will be unable to perform their normal functions, including routine repairs. Tissues made from such cells will be inherently vulnerable to sickness and injury. Ultimately, the body's self-regulation systems will break down. The body will spin out of control and become diseased. Due, to our poor diets and our toxic environment, cells are often deficient and toxic when we first create them, becoming progressively more so over time. And then almost any challenge to a compromised system can be the straw that breaks the camel's back. So to get well and to become biologically younger, your job is to make every new cell better than the one it's replacing by paying attention to deficiency and toxicity. We put a lot of wear and tear on the body every day, and if your body is not fully self-repairing daily, then repair deficits will accumulate. So any illness is a sign that you need repairs that your body isn't making. If you don't keep up with the maintenance on your car, repair deficits make it age, break down, end up in a junkyard. Your body's no different. Repair deficits manifest as aging, disease, disability. People with large repair deficits end up sick, frail, unable to care for themselves. People lined up for hip replacements or knee replacements because their joints are wearing out from lack of repair. All chronic disease involves repair deficits, and this is why they're degenerative. The problem is no one is teaching us how to make healthy choices. Invariably, those suffering from diseases have made poor choices, usually unknowingly, and they've caused their own illness. Yet we still prefer to think that disease is something that just happens, it falls out of the sky. Well, it doesn't. It's something we create. Getting well involves shifting the body back into the normal repair mode. Now, to do this, you need to give your cells the nutrients they need by learning how to eat a good diet and how to take high-quality supplements. And, in addition, you must keep your cells free of toxins that can disable the repair machinery. When you do this successfully, your body will once again properly communicate, self-regulate, self-repair, and good health will be restored. Good health will be restored. You will even become biologically younger. That's a good thing. You don't want to get biologically older. Either your cells are functioning as they should or they are not. It's that simple. They're working right or they're not. If they're not, you can exhibit thousands of symptoms in different body parts. No matter what the symptoms, if you address deficiency and toxicity, restore cells to normal, the symptoms will go away. To give different names to so-called different diseases may be useful for discussion purposes, but it's very counterproductive for treatment purposes because the name of your disease doesn't matter. There is only one disease, malfunctioning cells, and only one cure. To prevent disease, prevent cellular malfunction. To reverse disease, restore malfunctioning cells to normal. This is the same no matter what your disease is called. How to maintain good health is not a mystery. The human body is a self-regulating, self-repairing system. A healthy lifestyle is the most powerful medicine in the universe. Thousands of studies have shown that if you eat primarily a fresh, plant-based diet, get regular exercise, maintain a healthy weight, reduce stress, and don't smoke or take drugs, you'll reduce your risk of developing a chronic disease by at least 80%. Imagine the economic impact of that. And we're just trying to cut disease costs in half. Yet, how many people follow such a healthy lifestyle? The estimates are less than 4%. The educational challenge is this. Most Americans think they're already eating a good diet and living a good lifestyle, and yet we know less than 4% are. Today, few people know that health is a choice, and even fewer know how to make that choice. We've been trained to believe that we don't have to do anything special to maintain health, and that if we do get sick, we can go to the doctor who will give us a magic pill and make us better, make the problems go away. But it doesn't happen that way. People can't make better choices if they don't know how, and this is why we need a national educational campaign to teach people how to get well and how to stay well. Such a campaign requires that each of us, as individuals, become educated and take personal responsibility for our health. The broader societal changes will require political leadership and support from business leaders, civic leaders, clergy, and educators. But it all begins with you. When you do this, you can end disease in your life. Not only will you and your family reap the benefits, but you will also be contributing to a healthier community, a safer country, and a saner world. Let's give health a chance.